Why should mothers that are expecting continue with their regular maintenance care at the dentist?
Hey, welcome back, everybody. Today we have with us Dr. Nicolette Sarasano. She is from our Bonnie Lake practice, and I'd like to tell you a little bit about her. She graduated in the top of her class at the University of Washington. She was number 3, and she has numerous awards, including the OKU Dental Honor Society, which is the top 10% of your class nationally. So congratulations.
Yeah. One of the reasons we're really excited to have Dr. Sarasano on today is that you're expecting. Congratulations.
Thank you.
How far along are you?
I'm 35 weeks, so coming up fast.
Countdown.
And do you know what you're going to have?
No, we're waiting to find out, so hopefully a fun little surprise.
And if it's a boy, you'll name him Steve.
Yeah.
We'll see.
Definitely top of the list.
Yeah.
So we invited Dr. Sarasano here today to talk to us about dentistry and oral health and how pregnancy affects that.
And does oral hygiene change when you're pregnant?
It definitely can. It's always super important, but sometimes even more so while you're pregnant. There can be other symptoms. You're more likely to get with something that's called pregnancy gingivitis, and that's where your gums can become really tender. They can bleed more easily, so it becomes extra important to keep your teeth and gums really healthy and clean. Still brush 2 times a day, floss every day, and then also your teeth are more susceptible to having other problems as well. If you're experiencing morning sickness, acid in your mouth that can weaken the enamel, the outer part of your tooth, and then also increased snacking, and maybe you are craving carbs and things like that, so you might be more likely to get cavities too.
Sure.
Do you take x-rays when you're pregnant?
Dental x-rays are safe. Our offices use digital x-rays, and so that has an even lower radiation dose. And so sometimes it actually can be worse to not take an x-ray, because if we miss something, that could lead to a bad dental infection, which would be harmful to you and to your baby.
What about dental cleanings while pregnant?
Definitely, you want to make sure you keep up with your dental cleanings at least 2 times a year. Sometimes, like I said, with pregnancy gingivitis, your dentist might recommend that you have more frequent cleanings. Some people's dental insurance programs cover more cleanings per year, so it might be worth looking into to see if you might need to have extra cleanings as well.
Why should mothers that are expecting continue with their regular maintenance care at the dentist?
It's important to maintain your oral health by seeing your dentist regularly for many different reasons. It can both help you and your baby. So if you have dental issues, say if you have a lot of cavities and things like that and bacteria associated with those cavities, that has been found in studies to sometimes be able to be passed on to your baby, especially between mom and baby. There's a lot of kissing and sharing of germs and things like that. And so if you have a healthier mouth, that can help your baby in turn start off with a healthier start as well.
So what would you recommend patients that know they're pregnant, when would you recommend that they tell us when they come into the dentist? I know sometimes it can be kind of a private or personal thing to want to share news like that, maybe before they're comfortable sharing it publicly.
Definitely. It's a very personal thing, but it's actually very important to make sure you do tell your dental team right away, either as soon as you know that you're pregnant, or even if you think you might just be pregnant, because we might change the way that we do certain things.
Are there certain procedures that you can and cannot have when you're pregnant?
For the most part, it is important to keep up by seeing your dentist regularly. Most procedures are safe to have while you're pregnant. Usually your dentist will recommend doing it during your 2nd trimester. It's safe to have things like fillings, root canals, extractions. If that's what's needed to be done, it's safer actually for you to have that done while you're pregnant versus risking that turn into a really big infection, which in turn can put a lot of stress on your body, a lot of stress on your baby. But then there's other things that we definitely recommend waiting for. If you want to have all new veneers, things like that, elective procedures, it's recommended to wait until after you have your baby for those.
Thank you, Dr. Sarasano, for sharing with us today.
Well, thank you for having me. I hope I was able to help answer some questions that some of you might be having out there.
And as always, please leave comments below. We would be happy to answer any questions that you have. Next week, we're going to be talking about how to care for your infant's teeth and gums. And until next time, lights out.